When dogs take prednisone, typically after an injury, it can help them to temporarily reduce pain, inflammation, and improve mobility. There can also come with a lot of side effects: short-term overheating, increased appetite, agitation, etc. Long-term side effects can include things like Cushing's, tendon and ligament weakness, loss of bone density, probably not a great idea for the heart, etc., etc. Prednisone is a steroid. It's not a steroid like an anabolic steroid, but it's a glucocorticoid. Glucocorticoids are a type of corticosteroid. These hormones are produced by the adrenals, the little glands sitting above your kidneys. The adrenals make glucocorticoids when a hormone called adrenocorticotropic hormone, or ACTH, comes down and tells them to. So let's go ahead and actually draw this on the whiteboard. So we have an arrow coming down here, and the arrow is going to be coming down to the adrenals. So we have the adrenals here, and this arrow coming down represents adrenocorticotropic hormone, or ACTH. So ACTH comes down, it tells the adrenals to make glucocorticoids. Now, that's all great, but where does ACTH come from? So it's produced by the pituitary gland. So we're going to draw that onto here, but we're going to lower this down a little bit so we don't go off of our whiteboard. So we're going to say ACTH is here, and this is the pituitary gland up here. So great. Now here's the question. Why does the pituitary gland produce adrenocorticotropic hormone, and when? So it produces it when corticotropin releasing hormone tells it to. So let's draw another arrow here. And this arrow is going to represent another messenger, you could say, which is what they are. CRH, corticotropin releasing hormone. So corticotropin releasing hormone comes up and tells the pituitary gland to make ACTH. So, okay, great. Where does this CRH come from? It comes from the hypothalamus here. So the hypothalamus is what produces corticotropin releasing hormone. Okay, that's great. But when does the hypothalamus produce corticotropin releasing hormone? Well, it stops producing it when it gets a signal that there is too much cortisol. So what is the signal? The signal actually is cortisol. So we're going to draw a line here coming from the adrenals, because the adrenals are making cortisol. And when cortisol gets too high, it goes and it tells the hypothalamus to stop this cycle, essentially. When cortisol drops down too low, it removes this signal, this limiter on the hypothalamus, and the cycle will restart. Corticotropin releasing hormone will be released by the hypothalamus, and the cycle will start again until cortisol once again eventually gets too high, and the cycle will pause. So this is going to achieve homeostasis and balance in the body. So this is interesting. So what happens when you take prednisone, the steroid? Well, in most cases, it's taken orally. So it's going to be absorbed by the gastrointestinal system, and it's then going to enter the bloodstream. After that, it'll go to the liver, and it'll be converted by an enzyme into prednisolone. So prednisolone is actually the active form. That is what prednisone is going to become when it gets converted by the liver. So yeah, if your dog has a reduced liver function, this conversion could be impaired, at least to some extent. So prednisolone now is going back into the bloodstream, and it's going to bind to these glucocorticoid receptors. So this results in an upregulation of anti-inflammatory proteins and a downregulation in pro-inflammatory proteins. So when prednisolone goes around and binds to these receptors, it's going to create an anti-inflammatory effect by upregulating anti-inflammatories and downregulating pro-inflammatories. So it's going to work in two different ways to basically make the body less inflamed. So this is then going to lead to those positive effects, such as reducing pain, inflammation, obviously, and improving mobility as a result of those two things. So, okay, so we have this reduction in pain. We also have reduction in swelling. We're also going to have reduction in immune activity, though, which may not be great. It also increases blood glucose, and it suppresses this hypothalamic pituitary adrenal axis, also called, we probably should write it in, the HPA axis, right? So now we can see why it's called an axis, or we could call it a cycle. I kind of like cycle better. So the hypothalamic pituitary adrenal axis, or cycle, HPA. So prednisone, or its active form prednisolone, is going to be suppressing this because prednisolone is mimicking the effects of cortisol. Remember, cortisol is what tells the hypothalamus, stop, we have enough, you don't need to make more. So prednisolone is going to achieve the same effect. So we can write that in here. We'll write in, we will grab a different color to represent that it is not natural to the body. Prednisolone. Penmanship not good. So prednisolone is achieving the same effects to cortisol, and it's going to be down-regulating this cycle. So your natural production of cortisol and other corticosteroids is going to be suppressed depending on the dose. If it's a very small dose, it may not suppress it very much. A large dose would probably suppress it a lot. So something to keep in mind, that is going to depend on the dose as far as how severe these effects are going to be, but this is what can happen in this cycle. So if you're just on it for a few days, your natural cortisol production will be suppressed, but it should return back when you stop using it, because it's not going to have been suppressed for very long. If you're on it for a few weeks, a few months, even years, it can be really difficult to restart this cycle. Because what happens to the adrenals, these glands, again, right here above the kidneys, I don't know, it's like a little hat above the kidneys, they're going to atrophy due to disuse, because they're not going to be used in this cycle, because they're not going to get the signal to produce. So they're going to atrophy, just like a muscle is going to atrophy from disuse. So if you've been on prednisone a long time, suddenly stopping is going to produce a lot of problems, right? Because now your body does not restart the cycle, or it isn't able to, because of the atrophy to the adrenals. So then you don't have enough cortisol and other glucocorticoids, so you can have really low fatigue because you're very tired. You don't have these hormones. You have low blood pressure, or even things like you could even go into shock and really serious life-threatening symptoms because of the suppression of this axis from the adrenal atrophy. So when you're using things like anabolic steroids, this is very well known, and this is also known, but it's very common to use what's called PCT, or post-cycle therapy, after a cycle of anabolics. So that post-cycle therapy is taken to restart your body's natural hormone production, but especially to keep hormones in balance, to keep the body in homeostasis. So this is where Glandokort comes in. So Glandokort, again, is the adrenal bioregulator. It's derived from adrenal tissues of young cows. So it's one of the original bioregulators developed by Dr. Vladimir Kavinson in St. Petersburg. It supports the function of the adrenal cortex, where hormones like cortisol, again, are produced. So it helps to normalize the stress response and hormone regulation, and it is actually used in post-steroid recovery in those Eastern Bloc countries. So because prednisone is converted in the liver bioregulator set norm would also probably be helpful here. And bladonics, the thymus gland, immune system bioregulator, may also be helpful because of that immune system suppression by prednisone. And Ventfort, the blood vessel bioregulator, is often used with other bioregulator protocols to improve the action of the others by improving that circulation in the body. So basically, you may be able to use Glandokort as a post-cycle therapy after prednisone to support adrenal function and hormone regulation. Remember, I'm not a vet. None of these things are FDA approved. Do your own research. Talk to your veterinarian before considering any changes to your dog's diet or medications. Wishing you all the best with whatever works to keep your dogs happy and healthy. Thanks for watching.